the Asthma Allergy Center, allergist, immunologist, Dr. Giri Dandamudi. Welcome back.
Nice to be back in here.
Well, we've talked a lot over the course of the pandemic about COVID and a number of other health issues, but today I thought we'd talk to you about your number one specialty, and that is asthma. Is there a season for asthma?
Yeah, there's some seasons, but in general, I've been treating asthma more than 40 years. Mm-hmm. Still some people think, all of a sudden, why I got the asthma. You sure me?
You don't catch asthma.
You don't catch asthma, for sure. I always have that question. And then when it happens first time in the family, and including me, when my son had asthma attack when he was 2 years old, I was in fellowship. I was worried. I thought maybe first thing maybe I have to send him back to India.
Had you already decided that your specialty was going to be asthma at that point?
Yeah, when he had asthma. That was 1978. You know what I mean? So I was surprised, how come he has asthma? Then I found out a lot of family members in my family have asthma. I didn't know that. You know what I mean? So it runs in the families.
So some families are prone to having asthma.
No question that one. Any chronic disease in general, I usually put a triangle like this. The top of the triangle is the cone of the triangle is some kind of family history, genetics, something. Mm-hmm. Something is there. The other one, corner of the other one is some environmental factor. In asthma, childhood asthma starts with infections. The first infection they get, a viral infection, they simply produce more mucus. Mm-hmm. So we used to call it as a bronchitis, bronchiolitis, react to airway disease, all those things. It's all the same. They just have an inflammatory process going on in the lung more than other people. And then there is an environmental factor. In this case is the virus, like a flu bug or something. Then you develop a disease. You take any disease, like cancers. You have a genetic tendency. If you are a smoker, most likely you get the disease. So,
you know what? I probably should have asked this question first. What is asthma?
Yeah. What is asthma? It simply means, in a common term, to understand the patients, I tell them, hey, first of all, don't get scared off about asthma. Mm-hmm. It is a treatable disease. It is a very, very much treatable disease. Then what is asthma is you produce more mucus in the lungs. So you have more inflammation in the lungs than other people. Why? You have some genetic tendency. But the triggers could be different. In the childhood, it is infections. As they grow older, the infections get less and less. They outgrow the asthma.
Completely. You're
Not completely.
No.
That's what they think is. So I outgrew the asthma. Yeah, you outgrew the asthma attacks because the trigger is gone. Even when they grow older, they still cough and wheeze, when they grow older, when they get a cold. So we call it as an intermittent asthma triggered by an infection. And I tell these families, instead of taking the cough syrups, take an asthma medicine. You get better with that one.
What does it feel like when you have asthma?
When you have an asthma, because of the mucus production in the lungs, the mucus plugs up the airways. The airways go into spasm. The most common symptom is cough. Not a dry cough. It's like a deep coming from the chest up and then coming with the mucus. So the early symptoms is a coughing on exertion. When they run, they start coughing. When they're nighttime sleeping, they cough. So those early, if you have a family history of asthma, and if they get a cold or something, or an allergy, if they start coughing and some wheezing, because the spasm, sometimes you have an expiratory wheezing and you feel tight in the chest. And then you suspect the asthma.
Is it difficult to diagnose? Because cough, that's a COVID symptom, and it's a symptom of other things too.
You're absolutely right. That's why, So all my asthmatics who got COVID, I tell them it's not a big deal. You produce more mucus. COVID is a virus. it so happens you're producing more mucus. COVID produces more mucus than other people.
We see people with asthma use the inhaler. So what's the inhaler do?
So the triggers are different. So if you have an allergy, so suppose you have an allergy, it may bother your nose and eyes. But if I have an asthma, it not only bothers my nose and eyes, I also produce mucus in the lungs. So it's in fact allergy-induced asthma, infection-induced asthma. It doesn't matter what is the trigger, basic problem is the mucus. To stop the mucus, there are several types of inhalers. So in the olden days, the only thing that we gave is an inhaler. Before the epinephrine we used to give. So what it does is it opens up the lungs. I feel better all of a sudden because the lungs are closing. Then you take an inhaler, which is the rescue inhaler, it opens up. But underlying that is the mucus. People forget they have mucus. You have to treat the mucus to stop the mucus. Otherwise, their asthma is going to come back.
It's just your body's just producing more and more mucus.
Exactly. When you ask them, they said, I get this phlegmy stuff, not yellow, white, frothy, phlegmy, like spreading like that. That's what they cough out.
How dangerous can asthma be? Can it be fatal?
At one time, it used to be. Now, awareness with asthma is there. A lot of people know what is asthma, and they go to a doctor right away, or they use a rescue inhaler. And some of these rescue inhalers are also over the counter nowadays. But the problem with them is if you don't realize there is a mucus is the problem, and you don't get some steroids, is the inhalation steroids or by mouth steroids, or see a doctor, slowly this keep on building up. Then you're opening up a little bit, and finally you don't have a space to open it up, and they get into they get into respiratory failure.
Because on the crime shows, someone gets kidnapped, but the inhaler gets dropped on the street, and they worry, they're going to die. They don't have their inhaler. That's just a crime show.
Yeah, that's all. Yeah, that rarely happens. Now, most of the people we say severity of the asthma is intermittent asthma, and then persistent asthma. Persistent asthmatics always have a control medications, and they need a rescue once in a while. But those people who don't know that they have asthma, and they know that they have asthma, but they don't take the control medicines, those are the ones who get into trouble.
Are there people it's probably asthma, but I don't want to find out? I think that's the thing. People, they don't want to know for whatever reason.
That is human tendency. Denial is a human tendency. So this always happens. First time I tell I would rather tell them that you have asthma. It does not matter, because instead of taking a cough syrup, you take an inhaler. So cough syrup has more side effects than the inhalers. The inhaler is very good, but you can't use it too many times.
Well, we see Olympic athletes with asthma able to win gold medals.
Yeah.
It won't limit someone from their capacity to do.
Yeah, no question. People with asthma can do anything if they want to. Asthma is a controllable disease.
Different levels, different severity of asthma then? How do you measure the severity of asthma?
We do the lung functions. So level 1 asthma, if you are not having an attack, the level that your lung functions are normal. Level 2, your lung functions are normal. Level 3 and 4, your lung functions between 60 and 80%. In level 4, the lung functions are less than 60%. So we monitor the lung functions.
A day like today, it's hot and humid. Is the environment, are there things, we hear people, they're going to move to Arizona because they have asthma. Are there environmental triggers to asthma?
Yes. So the allergies is one of the one. Humidity is one of them. Even a cold air can cause asthma flare up in a cold air. But is in a well-controlled asthma. In the olden days, we don't have a controller medications. When my son had asthma, we don't have no inhaler in those days. You just give epinephrine. epinephrine. If it doesn't get better, stay in the hospital. We have only bronchodilators, rescue medications. The only medication that is controllable is steroids by mouth, but we can't use it all the time. So that's why now we have so many targeted medications, inhalation steroids, so safe, and asthma is a controllable disease.
And you're talking about steroids for the treatment of COVID.
Yeah, this is all the same steroids.
Same thing.
See, this is what I tell I was talking to a patient. I said, hey, let us make life very simple. So inflammation is all called as inflammation. We need inflammation because
Headaches, everything's inflammation.
it is. So why? Because you need an inflammation, because if you get infection, your cells, your infective agent is in the tissues. But the cells that fight the infection are in the blood vessels, inside the blood vessels. They have to get out. So you create some chemicals that histamine, basically, that open up the holes so that the cells can crawl through and fight the infection. That is inflammation. Everybody has inflammation. Is the inflammation is caused by infections, in case of COVID, in case of virus, in case of flu? Is it inflammation is caused by allergies? Is inflammation is caused by autoimmunity? Is inflammation is caused by the cancers? So all these chemicals can be suppressed by the steroids. That's why we use steroids, corticosteroids in every disease. But they have a lot of side effects when you take it for a long time. Short time they are okay.
There's something called well-controlled asthma. What is? How do you define that?
So for the patients, I tell them they don't do the lung functions every day at home. So they have a peak flow meter. What is a well-controlled asthma symptomatically means no coughing, no wheezing on exertion. So if I'm running, and it should not be coughing, and no coughing, no wheezing on at night time. If these two things are not there, your asthma is well controlled.
Asthma, 2 years old, your son, it can be outgrown. Can it show up later in life?
Yeah,
yeah.
it can come or it can stay on
It
it.
could come.
So his usually comes with an infection. Even today, when he get infection, so he goes for he uses that combination medications. Yes.
Can you use asthma as an excuse to get out of gym class in the Army?
So it used to be
Yeah.
asthma. If you diagnose asthma, they used to not take in the service. Now they take it. Now in those days, that's why we never labeled them, some of those people, as asthmatics, because the chances of going into the service are not there. So we used to call it as a bronchitis, childhood asthma, bronchiolitis, whatever it is. We used to call different names. But most of the people in the smoking is not good for anyone, but it's definitely is not good for asthmatics. Smoking, pollution, humidity, these are all aggravating factor for anything, for also asthma.
So are we at the limit of science on how we deal with asthma? Is there a point where is someone working on a cure for it, or is this are we at the best we can do?
See, that anytime you have inflammation is by cell products. The cell products are called as cytokines. So now there are targeted treatments for cytokines. There are very good medication. We call them as biologicals. So they target. Suppose you have a door and you have a lock and key. You can have a key, you can have a lock, but you can't use the key if I block the keyhole. So these targeted treatments or block the effect of that cytokine on the receptor. And these are used in cancers, autoimmune diseases. That's why you see all these biologicals from a pharmaceutical industry. Pharmaceutical treatment, we are moving away from pharmaceuticals slowly into biologicals.
And who knows what's ahead? In 20 years, they might be able to analyze our DNA, implant something in us that automatically fixes everything that we'd be prone to.
No question about that. So I tell my patients when they come, hey, if you have a kid today, and don't tell you live 100 years, you tell you live 125 years. It's sure, it's
Yeah.
going to happen. So when I was a kid, if you live 60 years, I will be happy.
Yeah.
So here, people are living 90 years, 95 years, and sometimes still working. So 30 years expectancy life has gone. So another, 30, 40 years, it will be 125 years. People.
Yeah, someone said last week, the first person that's going to live to 120 has already been born.
No question about that. Yes.
All right. Well, thanks for all the information on asthma.
Thank you for that.
Asthma expert, immunologist, allergist at Asthma Allergy Centers, Dr. Giri Dandamudi. Up next here on JTV, we'll learn all about the Civil Air Patrol.